July 1st, marijuana will become legal in Virginia, but CBD, which is made from the same plant, is already available, and there seems to be a lot of misinformation surrounding its use. Here to clear it up and clear up some of the confusion is Dr. Erica Steele from Holistic Family Practice in Virginia Beach. Dr. Erica, hey, how you doing?
Hey, how are you? Good to see you.
I'm good. So break it down. There is a difference between CBD and THC, right?
Yes, there is a distinction. So a lot of times people lump it all together, but the CBD, there's CB1, CB2 receptor sites that it affects, and I won't get into all of that piece of it. But THC is marijuana, what people think about when they think about getting high and things like that. CBD is more from a different component of the plant that helps with inflammation in the body.
Okay. And I understand there are a lot of benefits for CBD, right? Like it helps people sleep and some other uses.
Yes, there are really two distinctions for CBD. Number one is it's an anti-inflammatory, but a lot of times people don't realize to get the anti-inflammatory component, you have to have a higher dosing. So like a 3,000 milligram dosing, like 2 milligrams, 5 milligrams, what you would purchase in a store is not necessarily going to be high enough to be medicinal for anti-inflammatory components.
Okay.
Yeah.
So how do you choose whether CBD is good for you or THC would be okay?
So it's interesting, CBD, again, anti-inflammatory, post-traumatic stress, some mood disorders, not depression though, because, taken over a period of time, it can actually make the depression worse. But if you think about it, brain on fire, any kind of inflammatory process with the brain, it's going to definitely have an impact. THC actually has been shown scientifically for tumor, to assist with tumor growth. So if a person is growing a tumor, let's say in the instance of cancer, things like that, it has been shown to reduce those tumor growths significantly. So, but again, it's not a cure-all. And I think that's one of the things that we really need to consider is that all of these things are not cure-alls. A lot of times we'll use THC, not specifically in this state, of course, but we'll see it being used in other states more for cancer, more for people that, let's say, need to stimulate their appetite, those kinds of things, not necessarily mood disorders. Mood disorders that can actually make it worse.
Oh, wow.
Yeah.
Okay. All right. Well, good to know. I've noticed that you can go, online and get like 1,000 of the CBD oil, and then you can go to a pharmacy and get like 3,000, and it ranges from prices of maybe $20 to like $150. So should you be leaning towards the more expensive because it's better quality, or how do you know what you're getting?
Yeah, it's, because it's unregulated, right? Anybody can sell anything for any price, and price is not always the indicator, but I can tell you this, that true quality CBD does cost more. However, I look for more nutraceutical brands that have GMP certifications, meaning that they're pharmacy grade, that they've been lab tested, they're certified, et cetera. I stay away from multi-level marketing companies. I know people are probably going to be, what? Because their model is more profit centered. It's not necessarily people centered. And I'm more of a people centered person. I'm also not really big on staying on anything for a long period of time. Like in a case of an anti-inflammatory usage, you're going to use it for that short period of time and then slowly wean off of it. It's not really meant to, anything is not meant to stay on for long periods of time, because then you have adverse effects about it too.
Okay. Well, we have the information to get in touch with you, because I know that you have a lifestyle course, but we're out of time, but we put the board up so everybody can get in touch with you.
Of course.
Dr. Erica Steele, thank you so much.
Thank you. Have a great day.
You too.